Bloomberg Audio Studios.
Podcasts, radio, news.
This is Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio.
Well, I have a question for you.
Maybe later we'll talk.
I have a question for you,
ahead.
Carol.
Come on, Tim.
You remember
let's
the
do it.
food pyramid?
Yes, I do.
Okay, so
Big time.
maybe it's because I'm a quote elder millennial, but this thing is just seared into my head. It's actually was up in classrooms as a kid. It was everywhere.
Yeah.
The food pyramid, it actually hasn't been around for more than a decade. Now we have this newish plate, which is divided into 4 sections. It shows fruits, veggies, grains, proteins. There's a little glass of milk for dairy.
Yeah.
On the side, despite the plate, the FDA says
We're not doing so well.
we're not doing so well. We're not eating the healthy stuff. We're eating too much sugar, fat, and sodium.
All right, so why is this and how can we do better? We've been looking forward to this segment. Let's get to Dr. Yeeli Mui, who is Assistant Professor of American Health at the Johns Hopkins Bloomberg School of Public Health. Of course, supported by Michael R. Bloomberg, which is the founder, I should say, of Bloomberg LP and Bloomberg Philanthropies. Dr. Mui joining us from Washington. Dr. Mui, so great to have you here with Tim and myself. How bad are we doing, and why aren't we doing better?
Yeah, thanks so much for having me join. You know, we really need environments and systems to make healthy eating the easy choice. And so I like to think of it as a puzzle of some sorts where you really need different pieces to come together to support healthy eating. So what do I mean by that? When we think about healthy eating, one piece of the puzzle that gets a lot of attention are supermarkets, right? So individuals or families access to the nearest supermarket. But healthy eating is not just about physical access to supermarkets. There's much more to that. And there are often other pieces of this puzzle that get overlooked. And as a result of this limited picture, the food environments and our systems we navigate on a daily basis, unfortunately, fall short in supporting healthy eating being the easy choice.
What are the other things that we overlook? I think that's an important area we should go into. What is it?
Absolutely. So one example are thinking about cultural factors. Are the foods available reflective of the cultural values and traditions of individuals and families living in a community? So if I think about my Chinese and American background, for example, I grew up eating a wide variety of leafy greens, which we know are nutritious for us. So for me in my household, this involved bok choy, sesame leaves, bitter melon, and these kinds of vegetables are not readily available in your average grocery store. Another important factor that often gets overlooked is thinking about the affordability of healthy food options, right? So fresh fruits, vegetables, lean proteins, these tend to be more expensive than your ultra-processed and fast foods. And when we think about these socioeconomic factors, there's also time costs and time constraints. Maintaining healthy eating and maintaining a healthy diet requires time for planning, time for food shopping, getting around to different food sources, and also for preparation.
What about, there's so many areas I want to go in. I want to start with this idea of schools and the food that's available in schools, because that's top of mind for me right now. I have a young child who is in a public school in New York, and I'm shocked at the lack of healthy options still in this day and age that, in my opinion, are in the schools. He tells us what he has for breakfast. Sometimes it's like a muffin. They serve breakfast, by the way, at school.
I had no idea.
Yeah, I didn't know that either. But even talking to neighbors, the lunch options in high schools are like mozzarella sticks still.
Sure. So I think what more schools are doing is taking a more holistic approach to addressing the type of healthy food options available in public institutions like school. So as an example, there are more schools that are adopting what's called the Good Food Purchasing Program. And it's a more holistic approach in thinking about the broader food supply chain. So sourcing from local food producers, creating the infrastructure to support the distribution and transport of those foods to institutions like schools. So it's a really innovative, wonderful program that's being adopted in other public institutions increasingly across the country.
I should clarify, he eats a meal at home and then he eats a meal at school, Carol, because he's my son.
He's so like you, right?
He has to eat right when he wakes up.
Well, I want to be, Dr. Mui, I feel like we've talked about a lot of these things for a long time. And I guess, I don't know. So what's some simple advice, affordable advice for people who are just trying to do the right thing?
Yeah, I mean, I think there's a lot of strategies at the local level. So when we think about where people can access affordable fresh foods, I think there's often a lot of focus on supermarkets. But one of the downfalls of that approach is that we overlook a lot of other existing community-driven food security resources and assets that already are present and available. So, for example, smaller grocers, community gardens, um, local cooperatives, farmers markets. So I think if we can broaden our scope and think about the diversity of ways that local governments can support these other types of healthy food resources,
Right.
then consumers will have more options
I was going to say,
go to.
I went to school in New York City, and I used to love all of the grocers. It was kind of uptown, and
Yeah.
there were just every market, and you could just buy lots of fresh, all kinds of vegetables, fruit, and it was just so much fun.
It depends on the
and
neighborhood in New
inexpensive.
York, but a lot of places you're really lucky with what you have around you. Dr. Mui, what about how much of this can fall on like the big packaged food companies, fast food companies? I mean, how do you think about their role here?
Sure. I mean, I think it's hard to, you can't really disregard the influence of big food industry like fast food companies. I think where local governments can play a role in this is through how local governments, through their policies, determine the design and development of their communities. For example, through land use policies or zoning policies, local governments can decide what neighborhoods look like, where supermarkets can go, where there are opportunities for urban farming or food production in your community, where there can be community gardens, and also thinking about the transportation infrastructure that's needed to help consumers be more mobile in getting to these different food sources. So I think there's a lot of opportunity for policies at the local level to make healthier choices the easier choices.
See, and I thought this was going to be a conversation about the Mediterranean diet.
No, it wasn't.
No, interesting. No, some serious issues, though, for people certainly across the country and trying to figure out how we can do it better. All right, so appreciate it. Dr. Yeeli Mui, Assistant Professor of American Health at Johns Hopkins Bloomberg School of Public Health, as we said, supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies. This is Bloomberg Radio.